Hello, my name is Akarin Hiransuthikul. I'm a research physician at Institute of HIV Research and Innovation and a third-year resident in neurology at the Department of Medicine Chulalongkorn University, both in Bangkok, Thailand. Today, it is a great pleasure to have a chance to share the results from our study, hormone levels among transgender women and transgender men receiving gender-affirming care at the Tangerine Clinic in Bangkok, Thailand. Today, I will focus on gender-affirming hormone therapy or GHT, which is used to induce secondary sex characteristics to be more aligned with an individual's gender identity. And there are two forms of that: feminizing hormone therapy or FHT for transgender women, and masculinizing hormone therapy or MHT for transgender men. Without proper monitoring, GHT can lead to suboptimal effect or in contrast, supraoptimal levels, which would put users at risk for adverse events. Unfortunately, information on hormone levels among transgender population using GHT is still lacking, so we aimed to determine hormone levels among transgender individuals who use GHT in a real-world clinic setting. For enrollment, transgender individuals who attend the Tangerine Clinic between November 2015 and June 2020 and fulfilled these two following criteria were enrolled. For transgender women, reported current use of FHT and tested for both blood estradiol or E2 and total testosterone or TT levels. For transgender men, reported current use of MHT and tested for blood TT levels. Regarding hormone target levels, for transgender women, E2 levels of 100 to 200 picogram per ml and TT levels of less than 50 nanogram per deciliter. For transgender men, TT levels of 400 to 700 nanogram per deciliter. These are the results. On the left is the data for transgender women and on the right is the data for transgender men. For transgender women, 1,534 participants were included. One-third of that had at least one hormone within target levels, and these include 31.6% of those who had optimal TT levels only, 0.7% of those who had optimal E2 levels only, and 1.8% who had optimal of both E2 and TT levels. Two-thirds of the participants had neither hormone within target levels, and almost all of them had suboptimal rather than supraphysiologic E2 levels. For transgender men, 200 participants were included. 13% had optimal TT levels, 16.5% had supraoptimal TT levels, and 70.5% had suboptimal TT levels. These figures demonstrate linear trend changes of hormone levels over follow-up visits. X-axis indicates months from baseline, and Y-axis indicates hormone levels. For transgender women, we have two graphs. One is for E2 levels, and the lower one is for TT levels, both categorized by participants who had any hormone within target levels at baseline and participants who had neither hormone within target levels at baseline. And it can be appreciated here that the trend of both graphs were heading towards target levels over follow-up visits. The similar trend of heading towards target levels over follow-up visits can also be seen in the transgender men as well. So for transgender women, one-third of transgender women who were using FHT had any hormones within target levels in a real-world clinic setting. Most of those who had neither hormone within target levels had suboptimal rather than supraphysiologic E2 levels. At follow-up visits, more than half achieved or maintained at least one hormone level within target levels, suggesting benefits of transcompetent services available from a trans-led healthcare service. As for transgender men, only 13% of transgender men who were using MHT had optimal TT levels. Most of those who did not have optimal TT levels had suboptimal rather than supraphysiologic TT levels. At follow-up visits, there was an increase in the proportion with optimal TT levels by threefold, emphasizing a positive effect of supervised MHT in a transgender competent healthcare facility. And our work could not have been done without this wonderful group of people, including the transgender participants who were enrolled in our study. Thank you very much.